exploring the inferior surface of the cerebrum, brainstem, and cerebellum. The image displayed provides a photographic view of the brain from below, offering an inferior perspective. In this view, we can observe the brainstem and the cerebellum. The brainstem and cerebellum are located in the posterior cranial fossa of the skull. This perspective allows us to observe some of the cranial nerves still attached to the brainstem and certain arteries. Although appearing bluish, they are arteries supplying the brain. The brainstem is visible, and various cranial nerves can be identified in association with it. The basilar artery is clearly seen, situated on the ventral aspect of the pons. It ends by dividing into the posterior cerebral arteries, which provide blood supply to the occipital regions of the brain. The cut ends of the internal carotid artery are also visible. Additionally, the olfactory tract and the optic nerve, along with the optic chiasm, are seen in this view. The image presented shows the inferior surface of the cerebral hemisphere of the brain, with the brainstem sectioned at the level of the midbrain. As a result, most of the brainstem and the attached cerebellum have been removed. The cut surface of the midbrain is exposed, revealing a linear area of dark-colored brain tissue known as the substantia nigra, which is a nucleus of the midbrain. The frontal lobes occupy the anterior cranial fossa of the skull. The inferior surface of the frontal lobe extends from the frontal pole to the anterior tip of the temporal lobe, where the lateral fissure begins. These gyri resting on the roof of the orbit are sometimes referred to as the orbital gyri. They constitute the association cortex and have strong connections with the limbic system. In this view, the olfactory tract and optic nerve, along with the optic chiasm, can be seen. The olfactory bulb is the site where the olfactory nerve filaments from the nose terminate. Olfactory information is then carried in the olfactory tract to various cortical and subcortical areas of the temporal lobe. The optic nerves, cranial nerve 2, emerge from the orbit and continue to the optic chiasm, where there is a partial crossing of visual fibers. Posterior to the chiasm lies the area of the hypothalamus, which is part of the diencephalon. Behind the optic chiasm, we can observe the median eminence, followed by the mammillary bodies, both of which belong to the hypothalamus. The median eminence is an elevation of tissue that contains certain nuclei of the hypothalamus. The pituitary stalk is attached to the median eminence, serving as a connection between the hypothalamus and the pituitary gland. Sulci and gyri of the inferior surface of the cerebral hemisphere. The inferior surface of the cerebral hemisphere can be further subdivided into the orbital part and the tentorial part. Orbital part. The orbital part contains the olfactory sulcus, located at the medialmost part of the orbital surface of the frontal lobe. The gyrus medial to the olfactory sulcus is called the gyrus rectus. The remaining orbital surface is divided into 4 orbital gyri by a well-marked H-shaped orbital sulcus. Tentorial part. The tentorial part includes several important sulci and gyri. The collateral sulcus is located on the ventromedial surface of the temporal lobe. It delineates the outer boundaries of the hippocampal complex. This region encompasses the entorhinal, periorhinal, and parahippocampal cortical areas. The occipitotemporal sulcus, also known as the lateral occipitotemporal sulcus, runs anteroposteriorly on the inferior surface of the temporal lobe. It separates the inferior temporal gyrus laterally from the fusiform gyrus medially. The rhinal sulcus is situated on the anteromedial surface of the temporal lobe. It curves in an antero-posterior direction and serves as a boundary between the uncus and the temporal pole. Some sources consider it to be an extension of the collateral sulcus. The parahippocampal gyrus, or hippocampal gyrus, is a gray matter cortical region surrounding the hippocampus. It is part of the limbic system and plays a crucial role in memory and spatial navigation. The lingual gyrus, also known as the medial occipito-temporal gyrus, is functionally linked to visual processing, particularly associated with vision. It is believed to play a role in the analysis of logical conditions and the encoding of visual memories.